What is Sjögren syndrome in raw patients? Have you ever wondered how rheumatoid arthritis can lead to other health issues? One such condition is Sjögren syndrome, which often appears as a secondary disorder in people with rheumatoid arthritis. Sjögren syndrome is an autoimmune disorder that primarily targets the body's moisture-producing glands. This can lead to uncomfortable symptoms like dry eyes and dry mouth. But the effects can go beyond just these symptoms. In patients with rheumatoid arthritis, Sjögren syndrome is considered one of the systemic manifestations of the disease. Both conditions are autoimmune diseases, meaning that the immune system mistakenly attacks the body's own tissues. When Sjögren syndrome occurs alongside rheumatoid arthritis, it can introduce additional challenges. Patients may experience dryness of mucous membranes, fatigue, joint pain, and in some cases, involvement of other organs such as the lungs, kidneys, or nervous system. The dryness associated with Sjögren syndrome is often referred to as Zika symptoms. This happens because the immune system damages the salivary and lacrimal glands, leading to reduced saliva and tear production. As a result, individuals may suffer from dry mouth, known as xerostomia, and dry eyes, referred to as keratoconjunctivitis sicca. These symptoms can significantly impact a person's quality of life and increase the risk of dental issues and infections. When it comes to managing Sjögren syndrome in rheumatoid arthritis patients, there is currently no cure. Treatment focuses on alleviating symptoms and controlling inflammation. Common approaches include using artificial tears and saliva substitutes to help relieving dryness. Medications like hydroxychloroquine can also be beneficial, as they help manage joint pain, fatigue, and skin issues that are common to both conditions. In some cases, immunosuppressive drugs such as methotrexate or corticosteroids may be prescribed to control systemic inflammation. For more severe manifestations, biologic therapies like rituximab might be considered, especially if there is significant systemic involvement, such as vasculitis or severe swelling of the glands. It is important to note that because Sjögren syndrome shares inflammatory pathways with rheumatoid arthritis, some treatments can overlap. However, care must be tailored to each individual based on their specific symptoms and the extent of organ involvement. In summary, Sjögren syndrome in patients with rheumatoid arthritis represents a complex interplay of autoimmune responses. The presence of dryness symptoms and systemic inflammation can coexist, making it essential to recognize and manage this condition effectively. By addressing both rheumatoid arthritis and Sjögren syndrome, healthcare providers can help improve patient outcomes and overall quality of life. Always consult with a healthcare professional for personalized medical advice and treatment options.